Thank you, Mr. Chairman. Thank you, Ranking Member DeGette, and thank you to our witnesses for being here today. I have a constituent named Lawrence. He's from Granite Falls, Washington, which is a rural town in my district. He and his wife are super studious and diligent, and when they qualified for Medicare, they did their homework and they reviewed all the plans available to make sure that they would find the best one with the coverage that they needed. And they settled on a Humana Medicare Advantage plan and eventually found a medical home at a clinic 40 minutes away. That's just when you live in a rural area, that's how far away it is. And Lawrence's doctor's clinic is owned by Optum, which is a subsidiary of United Health Group. Last year, Optum announced that it would no longer be in network with Humana starting January 1st of this year. So Lawrence would not be able to see his doctor. Faced with having to either find a new provider or find new insurance, he ended up having to switch to a United Medicare Advantage plan to stay in network with his doc. Mr. Whaley, when United, a health insurance company and the owner of its own clinics and providers, pulls Optum clinics out of competing insurance networks, how does United benefit from that?
I think that's a clear concern of the payvider type model, where a insurer, in particular Medicare Advantage insurer, can acquire a physician practice and essentially say to that physician, you can only treat my patients. And so if you're a patient on, say, a rival insurance plan, then you either have to change your doctor or lose access to your care, or switch to a plan which maybe is more expensive.
And so this behemoth just keeps growing. Like, it's already a monopoly, and it becomes more of a monopoly. United Health Group CEO Stephen Hemsley, when he came before this committee, he told us that United's vertical integration, the ownership of the clinics, the doctors, the pharmacy benefit managers, the pharmacy, he told us that it drives down prices. Is that true?
We've seen no evidence that that's the case.
Nobody else has seen evidence of that either. Thank you. This is a gigantic problem with our healthcare system. United Health Group is the poster child. It is a company with more than $400 billion in annual revenue. It owns 1 in 10 physicians in this country. It is the company that is the poster child, the biggest abuser of prior authorization that delays or denies care, frankly, as part of its business model. And this company is gobbling up the healthcare system and jacking up prices for all of us. Not only can they force beneficiaries into their own plans, they also get paid based on how sick they say a patient is. And they purposely make patients look sicker in order to pad their pockets even further. And it's a lot easier to exaggerate how sick somebody is if you own the doctor and the medical record system and the way that a problem list is generated, and add sometimes meaningless diagnoses that just sound really bad. Research shows that patients are labeled as sicker when the insurance company also owns the provider. This is the definition of a monopoly and market manipulation, and this is what consolidation looks like. It's a huge part of what is driving up cost for patients. My constituents are sick of it. I'm sick of it. I think I can speak for every doctor in Congress who's sick of it. And this committee needs to take even bolder and more meaningful steps to stop this. So, Mr. Whaley and Ms. Tripoli, why is transparent ownership reporting important for healthcare entities? And what should this committee be doing to go further to break up United Health and other healthcare monopolies?
So for the example you raised, it's very likely that the patient in your district had no idea that their doctor had been acquired by an insurance company, and likewise the state of Washington probably didn't know, and Medicare through CMS also probably didn't know. And so if we are going to design policies to address this type of consolidation, we need to know actually who owns any individual doctor.
Start with transparency and knowledge. Ms. Tripoli.
I would just add that one of the things we're also seeing in these vertically integrated plans, and United Health is a perfect example, is that they're actually financially offering bonuses to their providers to upcode, to make their patients appear sicker, and there's documentation and evidence of that. And in these this vertical integration, they're also able to pay above market rates to their provider to the parent entities and to keep the delta so that they can actually appear on paper that they're meeting medical loss ratio requirements, but in fact, they're actually subverting the federal requirement and putting those to profits instead of to patient care. So I think some of the legislation for consideration today, strengthening encounter data, more transparency over medical loss ratio requirements and how plans in the MA program are spending their premium dollars, all incredibly tools to help us understand what's happening as the effects of consolidation for better intervention.
And that insistence that consumer dollars be spent on healthcare has been absolutely abused and perverted by insurance companies who are now controlling doctors. Thank you. I yield back.
Gentlelady yields